In a virtual ceremony held on the 21st of February 2024, Union Minister for Health and Family Welfare Dr. Mansukh Mandavia inaugurated a regional consultative workshop on research priority for providing accessible and affordable healthcare for the northeastern states of India. Emphasizing the government's commitment to equitable healthcare access, Dr. Mandavia underscored the importance of ensuring that health facilities are accessible to all, irrespective of economic status. Highlighting the union government's initiatives for the development of the northeastern region, Dr. Mandavia mentioned the distribution of over 31 crore Ayushman cards, providing free family treatment up to Rs 5 lakh annually, the establishment of 11,000 Jan Ashudhi Kendras offering affordable medicines, and the introduction of over 1.64 lakh Ayushman Arogya Mandirs. Additionally, he outlined the implementation of a comprehensive health surveillance system and One Health initiative through 48 BSL labs. The inaugural session also saw the opening of a marketplace and the launch of a master's program on health economics and technology assessment at the IIPH Shillong. Union Minister of State for Health and Family Welfare, Dr. Bharati Pravin Pawar, and Minister of Health and Family Welfare Government of Meghalaya, Dr. M. Ampreen Lingdaw, were present at the event along with officials from the Union and Meghalaya governments. Organized jointly by the Department of Health Research, Ministry of Health and Family Welfare, Government of India, the Indian Institute of Public Health Shillong, and the Indian Council of Medical Research, Regional Medical Research Centre, Dibrugarh, the two-day workshop aims to address research priorities for healthcare in the northeastern region. Speaking to the press, Union Minister of State for Health, Dr. Bharati Pravin Pawar, commended the progress made in delivering healthcare services to remote areas under the leadership of Prime Minister Narendra Modi. She highlighted the significant impact of initiatives like the Ayushman Bharat health and wellness centers in providing primary health care services in the Northeast. Dr. Pawar expressed optimism about the workshop's outcomes, expecting positive developments in healthcare technology accessibility and affordability for the region in the future.
Densities regarding the screening of hypertension, diabetes, cancer at a primary level, also the teleconsultation. Till date, we have crossed 20 crores teleconsultation successfully. So these are some initiatives, and Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, which is the largest scheme providing 5 lakh for the family, for the patient, the beneficiary through health insurance. So these are some very good initiatives, and I think all sectors, including health, is doing very good in all the states.
You spoke about setting up medical.
बहुत अच्छे स्टॉल्स लगे हुए हैं. मैं तो कहती हूँ कि हर एक स्टेट में वो विजिट करके क्या हम हमारी स्टेट में इम्प्लीमेंट कर सकते हैं क्या. कुछ है जो कि पोर्टेबल है, कुछ है AI बेस्ड है, कुछ ऐप के माध्यम से है. सो ये नया इनोवेशन है, टेक्नोलॉजी से जुड़ा हुआ बहुत अच्छा एक प्रेजेंटेशन मैंने देखा है, और मुझे लगता है कि हम सभी ने उसमें काम करेंगे तो ये एक अच्छा पायलट प्रोजेक्ट भी हो सकता है किसी जिले के लिए, किसी स्टेट में. तो ये करने के लिए आज जरूर चर्चा होगी, और हमारे ICMR के डीजी है, उन्होंने भी कहा है कि हम इफेक्टिव कॉस्ट में भी उसको लेके आए हैं. तो ICMR लगातार उस दिशा में काम कर रही है कि इफेक्टिव ट्रीटमेंट भी हो, इफेक्टिव कॉस्ट भी हो, और लोगों के लिए इजी भी हो. तो ईज ऑफ डूइंग में ये सब हो रहा है, और बहुत ही अच्छा. आपके माध्यम से मैं सभी को ये भी करती हूँ अनुरोध कि ये देखो और उसको इम्प्लीमेंट करने के लिए आगे आइए.